diabetic nerve pain in feet, before you consider surgery for neuropathy. The other alternative. As the patient, it is a commonly made mistake to want to give your health problem over to the doctor and just have him or her take care of it. For this reason, patients all too often readily agree to a surgical approach as the solution for their problem. Surgeons want to do surgery, they have been well trained to do surgery, and are indeed good at what they do. Despite this fact, you must not overlook your part in the equation, which is to take the responsibility for your case and not be misled into thinking that surgery is a cure-all for your problem. In terms of peripheral neuropathy, oftentimes the patient is far worse off after surgery has been done. This explained, there is indeed a surgical procedure which may be helpful for your neuropathy problem. You must however understand the information that follows before making any decisions that include surgery for peripheral neuropathy, as surgery in my experience is the most extreme form of treatment for the neuropathy condition. The surgical procedure being referenced for peripheral neuropathy is known as tarsal tunnel surgery for nerve decompression. Foot surgeons will often promote this approach in good faith, not knowing what else to do for the case. Even in the rare cases where the posterior tibial nerve and its plantar branches may be suffering from hard tissue compression in the tarsal tunnel near the ankle, the expected relief will probably not be forthcoming after surgery. The causes for neuropathy, as outlined in the guide Peripheral Neuropathy, The Mystery Unlocked, which is part of my neuropathy solution program, are probably also present with the person who has posterior tibial nerve compression. Surgery in and of itself will not correct these issues. The patient must correct them him or herself first. It should be remembered that foot surgery, or its equivalent in the hands, for the treatment of neuropathy symptoms is a high-risk procedure that must not be taken lightly, or unconditionally simply on the advice of a surgeon. With this in mind, a second opinion should always be sought before a patient consents to surgery. Remember, the responsibility for this decision is the patient's after all is said and done. It should also be noted that the recovery period after such surgery is usually at least 1 year, and is very often accompanied by poor healing, infection, and other serious complications. What's more, as mentioned earlier, if this surgical approach is done before the nerves have been put into a healthy environment as outlined in the Neuropathy Solution Program, a very poor and unsatisfying outcome is almost certain to result. My recommendation is to attempt bringing the unhealthy nerves back into a healthy environment first, by strictly following the procedures and methods taught in the Neuropathy Solution Program. If, after 6 months, the neuropathy symptoms persist at an unacceptable level, which is unlikely, then a patient should begin a diligent process of research in consideration of the tarsal tunnel decompression surgery, or equivalent hand surgery, under the direction of a good surgeon. For more information about the Neuropathy Solution Program, click the link below this video, where you see the published or description box today.